So session 1, you need a mat or something else that's comfortable to lay on. Could be a big blanket or a fuzzy blanket. And something to lay your head on. I just rolled up a sheet here because then I can adjust the height. But if you have a pillow, that is a really good height for you. Do it just so that you're really, really, really very comfortable. So you're gonna lay down. And that's where we're gonna be for today. Set yourself up, the pillow in the right spot. And you're gonna have your knees bent, with your feet flat on the ground, knees pointing up to the ceiling, and your feet really where it's most comfortable for your hips and your back. So what that means is play around. Bring your feet a bit closer together, maybe close enough so they touch. See how that feels for the joints above. Does your hip feel okay? Does it like it less? Does it like it more? Same with your back. How does your back change with your feet together? And then step them out wide, maybe as wide as your mat. And see how your feet feel here. Maybe it feels a bit more steady, but maybe it changes how you feel in your hips and in your back. So it might be more or less comfortable. And then sort of go into an in-between spot and see how this feels for you. So once again, check it out by how steady you feel, how comfortable your hip feels, how your low back is positioned. And that's going to be the most important part, is now picking where you feel the most comfortable. You'll hear me say this quite a bit because when we are working with pain, it is more important to find a way to be moving or not moving where you feel the most comfortable. If we put ourselves into uncomfortable positions, it feels unsafe in our body, and that can elicit more painful symptoms. So wherever you feel most comfortable is where to start. And then we're not going to move our legs, we're just going to move from our pelvis. So I'd like you to start. You're going to press down into the ground with your tailbone. So your tailbone, just as a reminder, is the furthest point down on your spine. And just gently press down. So as you're pressing here, notice how much effort you're putting into pressing. And then ease off in that, because often we do more than we need. And I'd like you to press with maybe, like a quarter of your capacity. So it's really just at the point where you know that you're pressing, but you don't really feel too much effort to press. And then as you are continually pressing, notice what's happening in your hips. So the front part of your hips where you have the fold, the creasing, on the sides and on the back. See how it feels. So in other words, what kind of sensations relate to your pelvis being in this position. And then into your low pelvis, front and back side. So the area around your bladder and the area around your low back. Notice what position this pelvic tilt puts your spine in. Once again, how does that feel? Do you notice certain spots feeling a lot more? Or do you notice a certain area feeling a bit of relief? There are a lot of different ways to describe it, but just notice these things. And then relax, ease off that pressing of your tailbone. So you come into a place just neutral and recognize what it feels like for you to now be in that neutral place. And with that, I can give you a few options. Where did your pelvis move to? How does that change how your hips are feeling? Maybe you notice there's a different type of sensation with releasing. And then how does that change your low back position? And then we're going to go for another tilt, but this time I'd like you to press down into the mat with your bladder. So not your belly button, with your bladder. So space between your pubic bone and your belly button. So right in the middle there. And press down into the mat. And then once again, notice how much effort you initially put into pushing down into the mat. And see if you can ease off a bit so that you are at that point where you know you're pressing down into the mat with that low back, low pelvic region, but you don't feel too much effort. With being here now, check in to what it feels like starting at your hips. How did this change your hip position? Maybe it changes something in the front where your hips are normally creased, or on the sides or on the back. Just notice how the pelvic position maybe feels left versus right on your hips. And then notice what it feels like for what muscles are activating for you to press down into the mat. And then what muscles maybe are eased or inactive or relaxed when you press into the mat. What kind of spinal position this pelvic tilt puts into you. So do you notice your back flat on the ground? Do you notice maybe a little bit less effort or more effort than you would be if you're in a relaxed, neutral position? And then from here, just ease off so that you just come into an easy position. So that's somewhere in between where you would just, I don't know, relax into. Like where you would go if you were just going to lay on the ground and whatever your back does then. So notice what position your back comes back into, and notice what it feels like for your hips to now be in this neutral, easy position for you. And then we're going to go for more continuous movements. So tilting again with pressing down your tailbone. Same thing, just a little bit of effort to that point where you know it's easy enough for you to be there, but you still feel relaxed. So check that out. Maybe circle your wrists, wiggle your toes, shake your head to the sides, rotating, shaking out your jaw. Maybe patting your belly or patting your thighs, maybe even patting on the sides of your hips. So checking out so that everything else in your body can be quite relaxed, except for the tip of your tailbone pressing into the ground and whatever muscles are involved in order for you to be pressing down at the tip of your tailbone. And then ease out. And then press it down with your bladder again. Same thing, just that quarter capacity, nice and easy, enough that you know you're doing it, but not so much that it feels effortful. And then we're going to do the same thing. Shake out your head and your jaw, shake out your hands, wiggle your toes, and then maybe pat around your pelvis, pat on your belly, pat on your ribs, maybe down the sides, maybe to the outsides of your hips, onto your thighs. All of this so that everything in your body can be as relaxed as it can for today while you're just gently pressing down with your belly into the ground, and then relax. Take that moment in between and just see how your body feels. Good. And then press down with your tailbone again, once again, just to that quarter capacity. And then from here, you're going to maintain that same quarter capacity, but we're going to do a tiny, tiny movement with your knees. And when I say tiny, I mean very tiny. I don't necessarily want you to do something big where you feel something quite obvious. I'd like you to pay attention to doing something quite subtle. So you're pressing down with your tailbone, easy effort, and then your knees almost shake. going out to the sides, both out, both in, both out, both in, out, in, out, in. It's tiny, tiny, tiny movement where it's enough that you can feel some type of movement in your hips, but not so much that you feel a stretch, not so much that you feel, muscles working. Just enough that you can feel motion, but you don't feel anything secondary to that motion besides the sensation of your joint moving. So as you're shaking your knees both in and both out, keep pressing down with your tailbone. And we're going to do that same thing. Is you're just going to shake out your head, shake out your jaw, shake out your hands, maybe wiggle your toes, and then pat your belly. So as we do all these other motions, as we're trying to shake our knees, don't be surprised if you find a miscoordination, and that's okay. Part of this whole process is not being as concerned with doing things perfectly and doing them well. It's just about doing them so that it feels good. And feeling good is, an individual process. So just finding a way to settle your body, relax your body, move your body that in a way that can be pleasurable, enjoyable, fun, and maybe a little bit goofy. And then relaxed. Just a nice even wherever it feels in this in-between space. We're going to just notice. I could go into all these other ways of explaining that, but the process is just noticing what sensory information you are picking up. So where do you feel things in your body? Do you feel things around your hip, in your belly, in your back, your legs, your arms? Does it feel different on one side than the other? And then coming into the other tilt, so pressing down with the space behind your bladder and pressing down there just with enough effort that you can feel you're pressing down, but not so much effort that you feel like it's work or effortful. And then same thing that we did on the other side, starting with those tiny, tiny motions, almost little shakes of your knees. So both knees dip in and out, in, out, in, out. So small enough that you don't feel stretch, that you don't feel muscles working, but big enough that you can feel motion in your hips. And then, if you couldn't have guessed, we're going to shake out our head, shake out our jaw, shake our hands, not worry about our knees becoming a bit uncoordinated as we shake other things. And then pat our belly, pat our hips, pat our thighs, pat our ribs, just moving other things. Good, there you go. And then pause. Let your knees still shake, your belly still slightly pressed down, and then release it all. Just come into a nice easy spot for you. Checking out the sensations, checking out what it feels like. And then you're going to put your hands on the outside of each of your hips, where your thumb is in that crease of your hip where your leg meets your pelvis. And you're just going to have your hands there. We're not going to do anything with the pelvic tilt, but you're going to go for those knee shakes again. Just a little bit, so both knees in and out, in and out. So it's just that tiny, tiny motion. Now, with your hands being there, just hold your legs, not grip them, but that softness as if you're holding a newborn baby. or you're holding a kitten, where you don't want either of those to fall to the ground, but you also don't want to squeeze. You don't want to hurt them. You just want to care for them, protect them, but be gentle with them. So that same type of grasping of your hips. And then we're going to do a little process of just recognizing what your hips feel like as they're doing this. Can you feel something different on one side versus the other side? Remembering we're not going to the point of having a big stretch or having muscle work, just enough that you feel motion. And that's where this is coming into. What does one side do for motion that's different than the other side for motion? And now see if you can bring your knees a little bit wider so your feet can stay still, but now you're going for a little bit more of that same in-out motion, but just with your knees further apart from each other. And how does that feel? Does it all of a sudden go into a stretch or go into some muscle effort? Or does it still feel just enough, like your joints are moving, your muscles are moving, but you don't really feel that much effort? If it's that latter point, great, keep with this. If it feels effortful or if it feels limited, if it feels anything along those lines of, oh, I'm bordering on too much, this might be pushing, even in the slightest sense, ease back out. The motion we are trying to work with right now is not going to those boundaries. So going to the boundary of restriction, or, so tightness, immobility, that, or a stretch, or the other end of the spectrum of effortful muscle activity. So muscles, working hard and getting tired. And so you're working on the strengthening side of things. All we're working on right now is that window where you're moving, and because you're moving at a light pace, it feels safe. Because you're moving in a range of motion that doesn't go to either endpoint of effort, so you don't enter into tension. We're moving in that window where things feel easy. And because it feels easy, you can get a lot of circulation into these regions. The muscles are contracting and helping pumping the fluids, blood, and lymph into the area, but they're not moving in a way where they become tight in stretching and limit circulation, or they constrict and contract so much that they limit circulation. That window in between where it's a happy window of enjoyment and easy type movement is a nice window to be at when we're working with pain. So now that we're probably getting close to enough, take a pause. Hands can go where they please. And then if it feels more comfortable for you to straighten your legs out than to keep your knees bent, go for that. And then just leg here for a moment. It's not going to be too long, but just enough to let what we have done settle into your system. And it's a really important part, is that integration, because pain isn't just a physical process. It's a neurological process as well. And so with the neurological process, we want our nervous system to recognize and learn that movements through painful regions doesn't have to be painful, it doesn't have to be unsafe, so there doesn't have to be as much protection around it. We want our mind, our nervous system, to recognize these regions are safe and that they require nutrients. They require blood flow, and the way that we get blood flow through a region is for us to have muscles that are pumping, contracting, relaxing in a nice, even, balanced way. So when our mind can start recognizing that it feels good to move, feels safe to move, the more likely we will start to recognize that pain isn't as necessary to warn us about a problem occurring. And then you can start finding a bit more clear of a pattern or a repatterning of how to move through the region that can benefit your body instead of inhibit your body. All right, so there we go. You can sit up or lay down. You can continue napping. And that is session 1. Session 2, I will give to you soon. And we will continue to progress on in various forms of movement and relaxation techniques. Lots of love.